I'm Dr. Ashley Alexander. I'm a general surgeon at Prisma Health. Originally, I'm from Dallas, Texas. I moved to Alabama for both college and medical school, and then returned to Texas to complete my surgical training in Fort Worth. So a general surgeon's practice is kind of twofold. One part of it is an elective practice where patients have a diagnosis that needs surgery, but it's not an emergency. So they come see me in the clinic, we talk through what's going on and the options that lead to how to fix it. These types of problems in surgeries typically are involving the gallbladder, the abdominal wall, including hernias, the breast, the thyroid, the parathyroid, or skin conditions such as fatty tumors called lipomas, or skin cancer, including melanoma or squamous cell carcinoma. On the other hand of this is the emergent setting. So in my practice, I take call, and when patients come in that need an emergency surgery, that's typically more of something like the appendix, the gallbladder that's infected, a hernia, a bowel obstruction, things that are more pressing than those diagnoses that we talk about in the clinic. I love everything. That's why I chose general surgery. I was fortunate to come from a program that had a skill set of subspecialist surgeons, so I've spent a lot of time on the robot doing minimally invasive surgeries. That includes anything from your gallbladder to appendix to intestinal surgery, but also things like abdominal wall hernias, so very large hernias that may be turned away from other surgeons. I have experience working on using different types of mesh and specialized repairs that are long-lasting. Really, when I started kind of in medical school being exposed to the different specialties, I got this feeling that, when someone is in need of a surgery, it's the worst day of their life and they're looking for a fix. And in a lot of medical specialties, that option is not there very quickly. There's different medicines that can help to heal. There's different treatment plans, but surgery was really the one that stuck with me, as I can either offer you a way to get rid of this problem or improve this problem right now, or I can't. And it kind of changed the way I thought about medicine, the way I thought about my patients, and was just more rewarding to me than some of the other specialties. Even though they're very important, they're just different. With me, a huge thing is communication. I, in a previous life, was a gymnastics coach for several years, and really, to get someone to work with you and be successful in their goals, you have to tell them what those are and how they get there. And so I'm a big proponent of having a conversation from the beginning of what's going on and how are you feeling and why are you here, to here's the options that we can offer to make this better. And I feel like having that kind of two-person conversation, or even multiple people if they bring their family members, gets us to a point where they can ask questions and I can explain things very in detail so that they know what's going on and they can make an informed decision. When I'm not at the hospital, I'm usually doing activities with my 6-year-old golden retriever, Butterbean. He loves everything from going to the beach, to the lake, to the mountains, to just the local restaurant or outdoor seating area. To make an appointment with me, please call the number on the screen.